all, it's Dr. Ruth Dotton here. I'm a board certified adult psychiatrist, and today I'm going to talk about what bipolar disorder is and what bipolar disorder isn't. Now, there's a lot of misconceptions about bipolar disorder, and that term gets thrown around really flippantly. So bipolar disorder is a mental health condition in which there are discrete mood episodes of depression or mania or hypomania if it's bipolar 2 disorder. So in a discrete major depressive episode, the individual is going to experience symptoms of low mood, they're unable to enjoy things that they're previously able to enjoy, they're having poor concentration, poor energy, changes in appetite, changes in sleep, low self-worth or feelings of guilt, and in severe cases, they may be having thoughts that life isn't worth living or that they want to hurt themselves. And these symptoms in a major depressive episode would be lasting for at least 2 weeks. And then on the other end of the spectrum, they're going to have episodes of mania or hypomania. And in mania, it's essentially the opposite of depression. That's when people are having symptoms of decreased sleep, increased energy, increased goal-directed activity. They're talking faster than normal. They're being more impulsive than normal. Think about having risky sexual encounters, using substances they wouldn't normally. Maybe they're getting tattoos they wouldn't normally, getting into fights. They're easily agitated, get aggressive. And in severe cases, they might start experiencing psychotic symptoms like hearing voices, getting paranoid, thinking that they're talking to God or that they have superpowers. And these manic episodes, if it's hypomania, they're gonna last for at least 3 days. And if it's a full manic episode, it's gonna last for more like at least 5 to 7 days. Now, this is in contrast to mood lability. So in bipolar disorder, these switches in mood are happening over a period of days to weeks. And this is in contrast to mood lability or mood swings, which happen from minute to minute or hour to hour. This is not bipolar disorder. There can be lots of causes for this. It can range from things like the way that someone's brain has learned to cope or respond to different stimuli in response to severe trauma. It could be due to some underlying personality pathology. It could be due to severe anxiety, any number of causes. But the reason that it's important that we make this distinction is because the treatment of these conditions is not the same. And the medications that we use to treat bipolar disorder, like mood stabilizers and sometimes atypical antipsychotics, although they can be really important in stabilizing a person and reducing their symptoms, they're not risk-free. They do have potential side effects like weight gain. Sometimes they need a very specific level in the blood, and so we have to check blood levels. They can cause things like metabolic syndrome, sometimes issues with your blood counts or your liver or your kidney function. So it's important to make sure that the benefits of these medications outweigh the risks. So if someone is being prescribed these medications for a misdiagnosis, the benefits may not outweigh the risks. So if someone has mood lability rather than a bipolar diagnosis, then other potentially lower risk interventions, things like therapy, lifestyle modification, or maybe lower risk, of course not zero risk medications, things like antidepressants or maybe anxiolytics could be potentially better to address their symptoms. So it's important that you have a good relationship with your mental health provider and that they get to know you over a period of several different visits in order to be able to make an accurate diagnosis. And if someone has given you a diagnosis and you're not sure that that's accurate, feel free to ask questions. Ask them, why do I have that diagnosis? Can you really explain it to me? Can you go through your criteria? As well as talking about the role of why you're being prescribed a medication, what the risks are, and the benefits of that medication. Wishing you all good mental health today, and I hope to see you in the next one.